Good afternoon, the members of the press, ladies and gentlemen. I am Dr. Mujtaba Umar, the president of the Association of Resident Doctors, Ard Uduth University Teaching Hospital, Sokoto. I'm here to give us a brief briefing arising from the extraordinary National Executive Council meeting of the National Association of Resident Doctors held on the 2nd of January 2026. The Association of Resident Doctors, Ard Uduth University Teaching Hospital, Sokoto, wishes to brief the public on the outcome of the extraordinary National Executive Council meeting of the Nigerian Association of Resident Doctors held virtually on Friday, 2nd of January 2026. We can recall that in the September 2025 AGM, Annual General Meeting of the NAD, held, and arising from the meeting, an ultimatum was given, 30-day ultimatum was given, and with 19 demands of the NAD, which arose from the gap noted in the health sector, as well as welfare and remuneration issues. After the elapse of the 30-day ultimatum, without anything coming from the side of the federal government, the NAD decided to embark on the total, indefinite and comprehensive strike, which lasted for 1 month, throughout the month of November. Reconciliation, dialogue were done, and the demands at certain ultimatums were put on the demands: 2 weeks, 3 weeks, 1 week, 1 month. Some a committee should be set, and that in its own wisdom decide that due to public sympathy and our patients, that we should suspend the strike and resume, and give time for the federal government to implement this demand. Unfortunately, throughout the month of December, nothing comes out, and the NEC converged again on the 2nd of January to deliberate, to deliberate on the matter. The emergency meeting was convened to review the level of implementation of the Memorandum of Understanding really entered into between NAD and the federal government through the Federal Ministry of Health and Social Welfare, as well as the Federal Ministry of Labor and Employment, following NAD 19 demands bordering the welfare, remuneration, training, and professional practice. After extensive deliberation and a thorough review of engagement with the relevant government agencies, the extraordinary NEC observed with grave concern the persistent failure of the government to honor critical aspects of the Memorandum of Understanding. Key observations include rejection of the decision by the Federal Ministry of Health and Social Welfare to redeploy 5 disengaged resident doctors of the Federal Teaching Hospital, Lokoja, contrary to the recommendation of its own investigative committee, and as well as the House Committee on Health. The Council also noted prolonged delays in transmission and payment of promotion and salary arrears across several institutions. Furthermore, the INEC observed that the approved professional allowance table has not been fully implemented, with accrued arrears yet to be paid and inadequately captured in the national budget. Persistent ambiguity regarding skipping and entry-level placement remains unresolved, while eligible residents continue to be excluded from specialist allowance payment, despite clear directives from the Office of the Health Service of the Federation. The Council also expressed deep frustration over the delays in non-payment of the House officers' salary and arrears, the failure to issue a formal pay advisory, the continued recategorization of the MDCN membership certificate, and non-issuance of the certificate by the National Postgraduate Medical College after Part 1 examination. Other unresolved issues include stall regulation of locum engagement and excessive work hours, a non-functional collective bargaining agreement process, outstanding salaries and allowances in several federal and state tertiary institutions, unresolved Commerce 25% arrears affecting significant proportion of members, deteriorating hospital infrastructure, obsolete equipment, and failure of the Special Pension Benefits Committee to resume sitting. Following this observation, the National Executive Council issued clear resolutions and demand, including immediate reinstatement of the disengaged resident doctors at FTH Lokoja as recommended by both the Federal Ministry of Health Committee as well as the House Committee. From payment of all outstanding salary, promotion and allowance arrears, full implementation of the professional allowance table, clarification on skipping and entry placement, immediate payment of specialist allowances, reinstatement of house salary issues, resolution of training certification challenges, resumption of CBA process, and urgent intervention to address infrastructure delay across health institutions. In view of the federal government continued failure to demonstrate concrete commitment to this agreement, the INEC of the NAD resolved on a total, comprehensive, and indefinite strike effective from 12 a.m. on Monday, 12th of January 2026. All resident doctors across the nation's 91 tertiary health institutions have been directed to withdraw their services completely until government takes genuine and reassurable steps to address this demand. Additionally, the INEC directed all NAD leadership and center executives to commence coordinated local, regional, and national peaceful protest from the same date, that is 12th of January. Ard Uduth aligns fully with this resolution taken at the national level. We reiterate that this action is not taken lightly, but is a consequence of prolonged neglect of agreements that directly affect the welfare of doctors and the quality of healthcare delivery in Nigeria. We call on the federal government and all relevant authorities to act urgently in the interest of the healthcare system and the Nigerian populace. My message to the patient is that we are with the patient. Patients are ours. These are people that we always dream of, people that we are always with. But this strike that we are doing, we want to get a better for them. As we said, a doctor that is not well remunerated, a hungry doctor is a dangerous doctor. So we want to give them our best. And this that we are looking for the best for them. We want to get a standard healthcare system that will benefit them very well, that they can have a maximum benefit from. Thank you very much.